Al doilea invitat, Konstantinos Dretakis, chirurg ortoped, director Departamentul Chirurgie Robotică Ortopedică, Metropolitan Hospital din Grecia. Hello, sir. How are you?
Hello, good morning. It's a pleasure.
What is your favorite team?
Well,
in football.
Well, my hospital is the sponsor for Olympiacos.
Ah, Olympiacos.
It's a sponsor. Our hospital is 100 meters from the Olympiacos.
So you are fan from Olympiacos?
Well, so and so. I am more from Panathinaikos because that was my, my neighborhood when I was young. But I have to support Olympiacos as a professional.
Yeah. What is? Can you explain in few words the system, the health system in Greece?
Of course. We have a public system that supports the health services in the statal hospitals, in the public hospitals, for everybody. Although after the financial crisis we came through in Greece, the public hospitals are not in a very good condition. So they have a waiting list, and sometimes you cannot get the perfect service you would need for the health. So we have private hospitals, and those private hospitals, they have agreements with the insurance companies. They get some subsidized from the state, from the health system, so they get like 20 or 30% from the state system for the patients.
Okay, and the other part is covered by an insurance.
By the insurance or private patients. But most of the patients in our hospital, because I'm working in a private hospital, comes from the insurance, private insurance.
It's a big hospital, Metropolitan.
It's a big hospital. It's one of the leading hospitals in Athens. It's 350 beds. It's expanding. It's three connected buildings.
Yeah.
We have state-of-the-art radiology, oncology, and 22 operating rooms. And it's an expanding, very modern hospital.
Who is the owner of Metropolitan Hospital?
Well, we have different shareholders. It's not one owner.
Okay, different. Who are they?
It's a bank.
A bank?
One bank is a major shareholder.
Can you mention this bank?
It's Piraeus Bank.
Okay, Piraeus. Okay, they have also a branch here in
Romania. They have branch there. It's a very well-known bank. Construction company from Greece, and some other shareholders which hold less than 10% of the shares.
Okay, so how much money they put on this project?
Well,
if you
I don't know exactly the numbers. I know that the money for the revenue last year, the money that the hospital sent to the revenue was 100 million euros.
Okay, for your center.
Yeah.
100
million euros.
Okay. It's a good figures.
Yeah.
Good figures, very good figures. So, from your experience, for your example, you have a private insurance from this?
I have a private insurance,
And how much money you pay on a year?
I pay 1,500 euros.
1,000?
1,500 euros,
Or on a year?
Yeah.
On a year, okay. And you cover, this insurance cover what? All type of disease, all type of surgery?
Covers any health coverage. Any health coverage, yeah.
And you have this insurance for how many years?
I have this insurance for 8 years.
8 years, and it's working?
It's working, yeah. I would recommend this type of insurance to everybody. It's a very nice combination. I mean, it's a very nice combination to be able to use your private insurance.
Let's say I'm a European citizen like you, and I want to pay like you over 1,000 euro, to have an insurance, the same insurance, and let's say to be treated in Greece. Do you think it's possible?
Yes, it is.
Okay, yes, so for me, for a Romanian,
I know it is, because we have many expatriates working in Greece.
Yes.
Or staying for a short time, for some months, and I have many clients that are Russian, Ukrainian, English, and they have coverage for a certain amount of time.
But I pay this insurance from your company or to other company?
You pay this insurance at the insurance company, and you get your coverage for Greece, in Greece.
Okay,
yeah.
in Greece, okay. In Greece, the health sector is it's good?
Well, the public system
You
after
mentioned
the
that
crisis,
it's not in a good shape.
in a very good shape, but I think it's getting better. Every year now after the crisis, we're getting stabilized, the economy is getting better, and we will turning this year in development. 2015, we will have development after 5-6 difficult years.
Yeah,
so
you mentioned that you want to put more beds in
yeah, of course, we're expanding, and we're looking forward to work together with other smaller hospitals or even acquire.
Do you have some cooperation with Romanian hospital or Romanian surgery?
Not yet. We're looking forward. We don't have any official. We have some patients that are coming spontaneously, but we don't have
Why,
any
they
official.
work there in Greece and come to you?
Yeah, they have
or,
some connection. They have friends. They have a member of mixed families, but we don't have any official partnership, and we were looking forward for that.
You want to make an investment here to make a hospital or to come with your system here in Romania?
We are thinking about that, investing and having possibly one joint operation here, or also we're looking forward to be able to treat patients in our hospital. Any kind of cooperation and joint work would be very, very good, and we look forward.
So your specialty is
I'm an orthopedic surgeon.
orthopedics, okay.
And I'm a founder.
You fix the legs, the
Yes,
arms. Yeah,
exactly.
yeah.
I'm founder and head of the robotic orthopedic department. We're one of the three countries in Europe that we have robotic orthopedics. This is a new thing.
And it's Greece and the other two countries? Italy.
And now Germany. Germany is starting now, yeah.
So, and this new state-of-art system is working in robotic, yeah?
It's working, it's very good.
Can you describe
Of course. It's a system for replacement of knee and hip. It's an American company. It's a very big American company, Stryker. This robot was made in USA from researchers, and it was invented 8 years ago. So in America now, in USA, 200 hospitals have these robots and use this technology. It is very important because with much less operation, with much less scar, with smaller operation, we can change only the part that is not working on the knee and the hip.
And how much is cost this robot?
Well, it costs. It's not cheap. It's an expensive technology.
But 10,000. No,
15,000 euros.
Okay, 15,000.
15,000 euros is the cost for the operation, but it is so important because it is improving tremendously.
But I mean the equipment.
The equipment is expensive. And
how many millions?
2.5 millions.
2.5.
Yeah.
Okay. And this surgery is 15,000 euro.
Yes, 15,000 euro. Yeah. But in this price you get everything. So in this price you get also the things you need for the operation, which are for one use.
Yeah.
You get the implants.
Yeah.
You get the hospital pay, the doctors pay, everything, the taxes, it's everything included.
Yeah,
there.
you mentioned that you make a surgery from a guy from 8 years, yeah?
Yeah.
Okay, these are you, okay. In Romanian, I had a patient 8 years ago. I made an operation, robotic surgery for fix the nickel.
The knee.
The knee.
Yes, we have many operations that we do in over 85 and 90 years old, because we think that everybody has the right to walk, even at the 90s and 95. There's no limit. You know, some years ago we were saying, oh, this is an old person, he's 80, 85, but no.
Yeah, a lot of people that said, no, I don't want to to make a surgery for you because you are too old.
But it's not the case anymore. In USA, there's no such a thing, and I think everyone has the right to walk, even 85, 90, and I think everybody at the 80s should exercise. Some kind of exercise, walking, swimming, something at the 80s, 80, 85. So it's the right of everybody. And if you don't walk,
so your dream is to, when you have 80, to play football, yeah?
Of course, and golf. Also, yeah.
Golf. So you play golf.
Of course, yeah.
How much money earn a doctor in Greece, in public sector and in private sector?
In public sector, they had a decrease of their income in the last years. So it was.
Give some example.
Yeah, 1,500 in the public sector. That's the mean. That's the median.
It's net or gross salary?
Net.
Net in
1,500 in hand, which is not too much money for Greece.
Okay,
not
100,
1,500.
500. And in private sector?
In private sector, there's a big, you know. I cannot say what is the mean salary. Of course, it's higher.
Okay.
But there are
some examples.
A very well-known good doctor could be up to 10,000, and somebody who is
10,000.
Somebody who's just beginning at the private sector could be somewhere around 2,000.
2,000.
Yeah.
Okay, so you mentioned 10,000 euro on a month.
This is for a very well-known, very well-known doctor at the private practice.
So on a year, it's 100,000 on a year. It's over in hand.
Yeah.
In hand. Okay.
We have something like 40% revenue, tax revenue in Greece.
Yeah.
Which is
higher.
High. It's very high.
Okay.
Yeah.
You should come here in Romania.
Why not? Yeah.
Yeah, to make a lot of money here in Romania.
Why not?
So, and your income?
My personal income?
Yeah. Because I want to make a joke. So you have enough money to play golf.
It's not expensive. It's not expensive golf. It's around 100,000 euros a year.
Okay. Okay, it's over. So you are well-known surgery in Greece.
I'm director. I worked many years, so yeah.
How many surgery you made a year?
Around 300.
300?
300, yeah.
So one surgery per day? Around
one or two per day, you know. We don't...
What kind of surgery?
Well, the main thing we do is hip and knee.
Yeah, okay.
Hip and knee,
okay.
And foot. That's what we do. And now we have more focus on the robotics, which is very modern. And we are one of the 3 countries in Europe, so we invested in that, and we are promoting the robotic orthopedic surgery.
What this equipment can do, and let's say your hand, physical hand, cannot do?
Accuracy. It's very accurate. Yeah. It's very accurate. You can see exactly what will be the result of the operation before you do the operation. So you can do a perfect plan, a perfect execution of the plan, and also you have much less complication. So you have a very good result. So your patient is coming back and is saying, "Thank you, doctor. I have a very nice knee now."
For all the doctors, your recommendation is to, if you have the money, to come to make this robotic surgery?
No, not all of the patients have the indication. Some of the patients, it's around 80% of the people who suffer from arthritis. Arthritis is a terrible thing because it's happening almost to everyone after some age, and especially after some injuries. So if you have a meniscus or cruciate tear sometime in the past while being athlete on sports activities, so after that, after 10 years or 20 years, arthritis is beginning at the knee.
I know.
So there are people, young people, 50, 55, 60, 65, suffering from arthritis. They have pain of their knee. They cannot walk. They try to do something with injections, with medication, but it's not working. So those need robotic knee. That is the perfect solution. Those, they're coming back again in their golf course They go to their sports activities back again, and we're so happy to see those back again in their previous. They're very happy. They say, "Thank you, doctor. I'm back in my life," because you get depression if you don't do the things you were doing.
In Greece, the doctors are respected?
Yes, they are
like
respected.
let's say society class?
They are respected, of course, and it's something that it's a good thing to, you know, I mean, most of the people wants their children to be doctors. It's something still good, although they're not so well paid in the public, and the last years they were suffering like everybody else.
You start your career in public sector, no? Or
yes, I had my education there. Then I worked in England.
In England, where?
In Bristol.
Okay, Bristol.
And then when I went back in Greece, I decided to work in the private sector.
How comes that you decide not to stay in England? Because I think the doctors are better paid and you prefer to return in Greece.
Yes, but you know, our country is very beautiful. We have sunshine, we have nice climate, nice places. So life, I would say, it's much better in Greece. Life is much better. That's why everybody's coming in for holidays in Greece.
Yeah. So your recommendation for people who wants to enter in to study the medicine is to go forward. Yeah.
Of course.
Yeah,
that's my recommendation to everybody. It's a fantastic thing to do. It's a very rewarding thing. It gives you happiness. You're a happy person.
And you make some money in the end.
Yeah, and you see the smile. You
100,000 on a year. It's a good money.
But not for the money. I don't recommend it for the money. Maybe with other things you can make more money. I recommend that for the happiness you get, the reward.
Yeah.
The smiling faces of the people you heal. That's the best thing.
This is the profession.
Yeah.
The dream of this profession.
Yeah.
Okay, thank you. Was Konstantinos Dretakis, chirurg ortoped, Metropolitan Hospital, Grecia. Azi am avut o ediție specială. Vă mulțumesc că ați stat atât timp cu mine. Ne revedem mâine de la ora 12. O zi bună în continuare.